Hello, my name is Alexandra Savastakova, and the cancer I chose to present was periosteal osteosarcoma. A little introduction to periosteal osteosarcoma, which is also known as PO, is that it is a bone cancer and it is found surrounding the bones. A little different than some other bone cancers that are kind of rooted deep in the bone marrow or deeper inside the bone. These kind of are as a layer above the bone itself. Um, so there isn't any evidence of medullary involvement. It is a rare primary malignant variant of osteosarcomas, and it is estimated to be about 4 through 6% of all osteosarcomas. So that kind of shows and emphasizes how rare it really is. Over here on the left in my diagram, I do have two kind of like red hazard lights, siren lights on here, and this kind of shows where on bones are more frequently located, and we'll get into that in just a second as well. So here's a little bit on the statistics. Periosteal osteosarcoma is going to be in white. It's about 6%, and 94% is the other osteosarcomas. Here we go. So a little background. So just like Dr. McFarland does in our class, I'm going to break down the Latin and a good way to remember the cancer itself. Peri is Latin for around. Osteal is Latin for composed of bone. Sarcoma is Latin for fleshy excrescence. Excrescence. Periosteal osteosarcoma directly translates to around bone, bone fleshy excrescence. So that kind of, again, just emphasizes what we talked about on the last slide, where the tumor and cancer itself is kind of a layer above the bone and kind of meets around the bone. The second thing we're going to cover in the background is going to be the location of it. Like we mentioned, and I had it labeled before, but it's going to be found on any long, flat bones. So really, it could be anywhere in the arm, it could be up here. I mean, it really could locate itself anywhere, but it's going to be a long, flat bone. Most frequently, it is found on the femur and the tibia. And then finally, for background, just for some knowledge, the race and age. So all osteosarcomas have been found to more commonly present themselves in people of color. Specifically for this PO, periosteal osteosarcoma, it has been found mostly in African Americans, people of Latin origin, Latino descent. So mainly found, and then the age is mainly found in younger patients. So it's from 10 to 30 years old. Incidence of periosteal osteosarcoma in older people, I think it was 60 or older, was a 1 in 10. So it's only a 10% chance you'll really see it in patients 60 or older. Okay, so risks. Of course, similar to other cancers we've covered, genetic diseases such as Leishman syndrome, Rothman-Thompson syndrome, and hereditary retinoblastoma, RB. These are mutations, genetic mutations that are found in patients. And of course, with mutations comes a higher risk to have any cancer, really, but that has been a commonality found in a few of these patients. Then risks also is just the age group. You can't really do anything to control that, but 10 to 30 years old, it's assumed because it's the bones and you talk about fastly dividing cells, when patients are going through growth spurts, those cells are the ones, the bone cells through growth spurts are quickly dividing. So mutations may occur during that time, and maybe that's kind of how we see that correlation. And just overarching those things we just discussed is just gene mutations in general. We will get to those a little more in depth in just a moment. Here's an image just to see it. I was looking into prevention. It is a more rare osteosarcoma, but when it comes to things like bone disease and bone cancer, there's not really prevention. You can't really do much. Of course, it is important to keep a healthy diet just so your body in general gets nutrients. But really, at least for the sources I looked at, there isn't really much prevention that can be done. You can't really prevent the bone um, from becoming this way. So, um, when discussing survival with this diagnosis, before the cancer has metastasized, it has found that PO has an 80% survival rate past 5 years. And this will also vary based on what source you're looking at. The newer ones, the generalized databases for all countries or just the United States. And so I have my sources at the end, but NCBI has the statistics saying it's about 80% survival past 5 years. And then once it has metastasized, uh, as time passes, it's just really the percent survival has declined and will decline continually. So below 60%. And again, it's an estimate because it's really hard to, uh, especially after metastasized and with the patient's prognosis, hard to give an exact number or survival. So symptoms, similar to other osteosarcomas, you will see a sudden, well, I guess this is not similar, but you will have extreme pain in the bone. You'll have swelling of the area, and that just comes from tenderness and weakness. One thing that I saw that differentiated from other osteosarcomas is it's a very, very sudden thing. You will one day feel completely, like, more or less completely fine, and then the next, you will feel a sudden pain. It doesn't normally escalate and build. Most patients report it to be very instant. Um, Something that's also observed, of course, it's osteosarcoma, so bone cancer. You'll have bone pain, tenderness, and then also a lot of fractures. Because this is a bone cancer that doesn't really root itself too much into the bone, it does eventually, of course, but initially, you will see, because it's on the outer part, redness and that swelling, or you might even just feel a lump on its own. As we saw in the prior x-ray, it is a visual thing from the tissue. You'll see kind of that boulder there. I will mention there is a trigger warning for the next image. It is a little gory. So this is another image of periosteal osteosarcoma. So if we see over here in image A, you can see that it's protruding over on this side and kind of visualizes what the tumor is looking like. This is after that entire area has been removed. So they completely just removed the bone itself. I won't get into that procedure. So, and the tumor is protruding over on the left side in image B. It's the more white and yellow calcium image here. And here's some other images. Okay. So we have our treatments. So ideally, the main goal would be just to go into surgery. If this is a case of a tumor that was caught early on and it hadn't metastasized, and we see that it is something that's localized and can be removed, all sources do state that they would just go in and remove it. In the case that uh, it isn't localized and has spread and rooted itself farther into the bone or made it difficult to remove at the time, regardless of what that may be, options do include chemotherapy. And so it is neoadjuvant therapy. Um, it is debatable amongst the multiple sources I looked into whether it is proven to be greatly beneficial. Um, But the idea would be to just kind of shrink that tumor down to, once they do go in there, they can cut it out and not cause much harm to the tissue surrounding. Um, so I guess the debate is really just like the long-term benefit of the chemotherapy for the tumor. And then also looking into it, PO doesn't normally have radiation. The radiation therapy can be used to mitigate the symptoms and make someone's disease a little more comfortable and less painful, but it is not used as a line of main treatment. At times, it can help to like kill cells when it's metastasized to a different area, it can like shrink tumors, but it really is just mainly looking at chemotherapy and surgery. Oh, there we go. Sorry. So now getting back to we're talking about genetic mutations. So fun thing about this, well, it's not fun, it's very sad, but interesting thing about this is periosteal osteosarcoma has so many genetic modifications or variety of or lack of when looking at the genetic variety between patients. So some alterations found in the tumor are that there some cells, not all, would have an additional chromosome 17, or that they would have an addition of just a fragment of certain chromosomes. Oh, sorry. And then, or sometimes they see that the the genes would duplicate and have an additional just portion, and so that would be like the 2q, 5p, 8q, um, and again all those other ones. And then so again going back to chromosome modification is sometimes they'd have a double duplicate of chromosomes in some cells, not all, but some of them, and that would be chromosomes 14 and 21, or again missing chromosomes 6, 8p, and 13. Um, they'll have amplifications of certain ones. And then finally, the thing I find interesting because I'm researching it is T53 point mutation. So it's kind of like a specific uh, mutation in that pathway. One thing also mentioned on here is that some of them just will not have a mutation at all, or maybe it is something that so few cells have that once we do biopsy and sample, it's hard to locate. But there have been many papers saying that there have been no mutations that they can locate, or nothing to differentiate the cancer from make it anything special, really. But so that is really interesting. It's really hard to pinpoint just one mutation to this osteosarcoma. And then finally, I just have two of my main sources. I did look into the National Cancer Institute, and it has a nice article on periosteal osteosarcoma, um, and then also the National Library of Medicine. That is everything from me. I appreciate your time and listening to my presentation. Thank you very much.